It's the unspoken mantra of every cell therapy startup. The fiercely protective creed, born in the lab and defended in the boardroom. Don't with the science. It's the magic, the core discovery, the very soul of this company. This instinct comes from a deeply personal place. It's born from years of painstaking work to find the one perfect combination of steps that proves the therapy works. The fear, which is completely understandable, is that changing any single variable will break the spell and the therapy will fail. But here is the brutal, unavoidable truth of turning a breakthrough into a medicine. The scientific process that works for one researcher in one lab for 10 patients will fail when you need to treat 10,000. To succeed, the science, or at least the way you perform that science, must evolve. This isn't with the science. This is making the science robust. It's not about changing the therapy's fundamental mechanism of action. It's about engineering a process that delivers the action safely, purely, and consistently every single time. It's closing an open step. It's automating a manual one. It's the 100 critical adjustments that turn a fragile miracle into a reliable medicine. The journey from the lab to the market requires a new mantra. Don't compromise the scientific principle, but relentlessly innovate the scientific process. Because the only way to honour a breakthrough discovery is to build a path that allows it to reach every patient who needs it.